Hello there. Good morning. If you just joined us here on the show, welcome back here on Prime Morning. And we've had some great conversations. There's still more to come here on the show. We'll say a big thank you to Nutri-Snacks for always making it possible for us to have conversations here on the show. Please do go and grab yours this morning. Your breakfast could be a lot better with Nutri-Snacks. And like I always say, it's a family thing. So once you're getting it, get it a lot so that everybody can have their own share. It's very delicious and nutritious as well. So please do not go a day without taking Nutri-Snacks. It's the best on the market right now. We're going to make our way to the Safari Valley. That's where a lot of things are happening. Every weekend, families gather and they enjoy nature. You want to be a part of that experience as well. So do make sure that this weekend, if you've got plans of traveling, it's just an hour drive from Accra and you are in the Eco Park where you can enjoy many things and also get to interact with nature as well. We've got so much you can also enjoy in terms of animals. We've got zebra, we've got wallaby, we've got elephant, we've got every, very friendly animals that you can find over there. The tigers and the lions are very, very, very nice people. Very nice people. When you go there and then you interact with them, you find out yourself, okay? So please do go and enjoy. It's 250 Ghana cedis, and if you've got kids who are less than 6 years, it's free. So yeah, it's a family thing, all right? Make it possible and enjoy the very best of every experience that comes with visiting Safari Valley. Now we're going to get into our next conversation, and this is our prime insight this morning here on the show, and we'll be looking at the issue of cancer epidemic this morning. I'm sure you've heard about cancers. You literally tremble anytime you get to hear anyone mention cancer around you, but if we don't talk about it, we wouldn't know what exactly the situation looks like. And so we're not able to, prefer some sort of measures to ensure that we're all, taking care of ourselves and we're escaping them, even though some of them you can escape it though. But in 2020, it is actually estimated that there will be actually 15 million cases of cancer annually. Now, 70% of which will occur in developing countries as well. Now, the Global estimates that 16,600 cases of cancer occur annually in Ghana, yielding an age standardized rate of 109.5 cases per 100,000 persons. Now, nearly 95,000 cases of cancer were reported in Ghana in 2019. In the previous year, around 90.7 thousand incidences were also registered, following an increasing trend observed since 2010. And there are facts that I'll be sharing with you here on the show as we progress. But of course, to help us, understand this better, and on this conversation this morning, I've got in here in the studio Dr. Hannah Ayite. And she's a senior specialist oncologist, National Radiotherapy, Oncology and Nuclear Medicine Center, the Kolebu Teaching Hospital. And she is here with us this morning. Doc, thank you so much for joining us this morning. I hope you're good.
Yeah, I'm good.
Great. We've also got Dr. Samuel Ntiamwa Boateng, and he's a specialist clinical radiation oncologist, also joining us this morning here on the show as well. Doc, I hope you're good.
I'm doing well.
Great. Good to have you on the show. And we've got Dr. Another Ayite, and another Ayite also joining us this morning. She's also a clinical oncologist, Kolebu Teaching Hospital, also joining us this morning here on the show. Doc, how are you?
Very well, thank you.
Great. So for the purposes of our conversation, Dr. Hannah and Dr. Na.
Correct.
Dr. Na first, Una second. We'll be addressing them that way. But it's a good time to have you here speak about this. I think a couple of months ago, we had to be delving into some of these cancers, of course, especially with breast cancer, because we celebrated it in sometime this month, October. And so it was something that was quite important that we speak about it. First of all, when we say something is cancerous or cancer, what exactly are we looking at?
So I suppose now one will take this. Okay.
Now how to refer to now one and how to.
So generally your body has a tight shift, right? It responds to a lot of cues to develop a certain way. So for example, if you have a wound, your body knows there's a cut, your body knows to stop the bleeding, your body knows that your skin cells should go and cover that.
Okay.
And once that happens, the cells stop growing. There's a response to a cue that you've touched each other it's okay to stop growing.
Okay.
Or even when you have a diarrhea and you recover. Initially, in a diarrhea, the lining of your gut will shed. But once you recover, the lining comes back and everything is okay.
Fine.
Exactly. Unfortunately, sometimes, because of all kinds of things, growing up, the food we eat, the things we take in, cigarettes, alcohol, all of those things can cause damage within the cells. And every body part is made up of a cell. Now, when this damage occurs within the cell, what happens is that over time, they are unable to respond to the normal cues. So instead of stopping growing, the cells continue to grow and grow without stopping. Sometimes it would grow this way, but it will be limited to where it started at. That's really not a problem. We call it a benign tumor.
Okay.
It's easy, you remove it, that's the end. But sometimes the cells are able to move from where it started from and to go elsewhere. So for example, in your breast, it will be able to go into your lungs or into your brain. That kind of tumor that has the ability to go to other parts of the body is what cancer is.
Okay. We'll look at like I said, the ones that are very major, and then we'll mention a few and try to deal with them. But at one point, does one now begin to think that, okay, my system is changing in a certain way that I feel I have cancer?
Okay. So like Na mentioned, there are certain things that, or what we call symptoms or signs, symptoms, sort of things that will make you start to realize that you may have a problem. And first of all, I like to mention that cancers can develop in any part of the body.
Oh.
Exactly. So it's important to say that before you start talking about what things you will start noticing.
Now notice that this is
because if we are talking about the breast, you may notice a lump or feel a lump in the breast, like she mentioned. You could also notice that one breast is probably remarkably larger than the others. I use remarkably because normally one breast could be larger than the other. So, and that may be fine. Yes. You could also probably have a discharge from the breast or blood from the nipple, coming out of the nipple. You may also notice that the skin of the breast is like an orange peel. There's a name for it, pod orange, orange peel like that. And then you could also have some wrinkling of the skin. It may not look as normal as the other one. You could also have cancer involving both breasts. Sometimes it can start from one, get to the other, or it could even start at the same time. So for the breast, these are some of the things that will make you want to go to the doctor. If you have cancer of the womb, probably, or the womb itself, or the lower part of the womb, which is called the cervix, you could have bleeding. Normally, if you are premenopausal, that is, you haven't reached menopause as yet, you'll notice that your periods may become irregular. You may not have the normal cycles like you should. So you'll be having bleeding in between periods. You may also be having foul-smelling discharge, brownish discharge. You may be having pain when having sexual intercourse. You may actually feel a mass there in your vagina. So, and these may make you go to the doctor. Bear in mind that these things I've mentioned may not necessarily mean you have cancer.
Okay.
But once you notice those symptoms, it will lead you to the doctor,
diagnosis,
to the health
eventually. Facility.
Exactly. Then when the test is done, they may find out that maybe it is benign, like one mentioned. or maybe it is actually a cancerous one. And that is when they've taken what we call a biopsy, a bit of the cancer, taken to the pathologist, the doctor who looks under the microscope to make sure that to actually diagnose whatever disease it is. And then you are diagnosed with a disease. So I've just mentioned two sides of the body so far. There are others. If you have cancer involving, let's say, the intestines, yes.
There's even cancer of the intestines.
Oh, too. Yes, of the intestines. So we have the small intestines, we have the large intestines. all the way to the end, the anus, where the stool comes out of. If you have cancer involving that part, let's say the large intestines, you may notice that when you go, you use the toilet, sometimes you have some blood stains, either blood coming out before, or blood mixed with the stool, or blood coming after the stool. You may also notice a change in the frequency of the times you use the toilet. You may probably be using it more frequently, or you may be constipated, depending on what may be happening. So then it will lead the doctor. So when you go with whatever signs you are, the doctor is thinking through what you are presenting and then trying to find out where the likely problem will be and where to do the investigation. Then just before you move on, you could also have cancers in the head and neck region. Head and neck means the eyes, the nose, inside the nose, behind the nose, in the throat, you know, and even in the ear, so or around the ear.
No part of the body is spared when it comes to cancer.
No.
That's intriguing.
Yes.
I'll come back to you. Doc, now let's try and then, maybe you also do a few of the cancers that we know, and then we'll now narrow it down to some of the most cancerous ones, the dangerous ones that are affecting people.
Okay. As I'm representing men here.
You're fully represented.
Yes.
So, fully represented. Gender bias though, yes. But it's okay. I'm here with you.
Yes. So I would mention prostate cancer. Some of the symptoms that might let you know that you may have prostate cancer would be we term them lower urinary tract obstructive symptoms. So you might start experiencing difficulty or pain when urinating. You might start having what we call hesitancy. You intend to urinate and you have to stand for some time before the urine comes. You might have what we call urgency. You can't control yourself. You can't control yourself to get to the bathroom before you pass urine. Those are all some of the symptoms that you may experience, and even poor erectile function. So usually that is what would lead a man to go and see the doctor. And when you go and see the doctor, a quick rectal examination would usually be done to see whether the prostate gland is enlarged. An enlarged prostate gland does not necessarily mean that you have prostate cancer. It could be what we call benign hyperplasia of the prostate. And a normal digital rectal examination does not also equate to not having prostate cancer. After a digital rectal examination, what would most likely happen is for you to do what we call a prostate-specific antigen test. Now, almost every adult man has heard of PSA, the PSA test. So you do the PSA test, and if the values are beyond the range of normal, then you do what we call a transrectal ultrasound guided biopsy of the prostate gland. That is what would confirm or refute the fact that you may or may not have cancer. So if you have prostate cancer, then
this is the processes that you go through to eventually get to know where you belong.
Yes.
Now, Dr. Haiti, let me find out from you now. If someone comes to you with all these symptoms that the person has mentioned, based on any of the cancers, as a doctor, what's the first thing that comes in mind? Does your mind go straight to, there could be a possible cancer here? Or let me just take my time? And you might not even tell the patient, by the way, but for you, looking at the situation, is that the first thing that comes to your mind? Also looking at where we're coming from or the part of the world we are in.
All right. So I just want to add to everything they've said that you can't actually have cancer without any symptoms at all. Yes. And probably that's when we want to see you, because sometimes the cancer is at a stage where it's so small that it's not giving you any problems. when we find it at that time, we are likely to be able to cure you.
Okay.
So someone can actually come and sit in front of me with all the problems they've listed and may not have cancer. And somebody will come and sit in front of me with nothing at all and may have cancer. All right. The problem over the years has been that, you know, cancer is a disease of older people. The older you get, the more likely it is that your body might make a mistake and then you can develop a malignancy. And for us as a developing nation, our major concerns were infections.
Okay.
And malnutrition, things like that. So for a long time, cancer was put on the back burner. It wasn't one of the things that you immediately go to if you saw somebody with symptoms. So for example, like number two said, if somebody came to the hospital with bleeding after defecation, most likely somebody would think it's hemorrhoids.
Okay.
Because in the past, it would usually be hemorrhoids. But that's not
Cancer
the
will
case
be the last thing
now.
that will come to mind.
Yeah, that will be the first.
Okay.
Cancer will certainly not be the first thing that
Yeah.
comes to mind.
Yeah.
If somebody comes to you with a discharge from the nipple or even a lump in the nipple, the first thing I'll ask is, are you breastfeeding? Because I expect that the breastfeeding might have caused an infection in the breast. Those are the likely things that you think about. But as we continue to go, it's become obvious that cancer is important. And so, by all means, be thinking about the most likely things. But please don't make cancer the last thing to consider. If you see a 50-year-old with a lump in the breast, be thinking about cancer. It's unlikely they are breastfeeding. It is unlikely, but it's probably cancer. So we just have to reorient ourselves to the changing dynamics. A lot of the things that we used to do in the past, we don't do anymore.
Yeah.
In the past, people used to walk from Cape Coast to Elmina. My grandmother always says, and it was a quick walk.
A daily routine.
Exactly.
Yeah.
These days, we sit in a car, we eat all the fried foods. We are bigger than we should be. You can see me. We are all bigger than we actually should be. Yes. And so our risk factors, which are things that increase your likelihood of getting cancer, have increased. We are drinking more. Some of us are smoking. The interesting thing is that a lot of young women are smoking shisha. Thinking that because it's going through water, for some reason, it doesn't cause cancer.
That's the most common thing you can find right now.
I'm very sorry. Shisha puts you at risk of cancer. Almost the same, or maybe even more, because they tend to smoke more of the shisha.
That's very true.
Exactly. And so a lot has changed. So even though for a doctor, you think about the common things first, we also always have to have at the back of our minds that based on the age of the person, it could be a cancer.
So undeniably, our lifestyles are contributing to what we're experiencing now.
Definitely.
Now, like Doc said,
Yes.
back in the time, if you're talking about cancer, you're looking at the West. Because you'll be there, they say, oh, this person has died out of cancer, this person has died. And you'll be asking, what kind of cancer is that?
Yes.
You have no idea it's happening here. But now it's like very rampant every single time. Look at the statistics.
Yeah,
Crazy.
actually worldwide, I mean.
Yeah.
And it's also reflecting in our setting. as
It's
well.
crazy. But let's look at our lifestyles. Are we managing it the way we're supposed to? If we're doing the extreme, why are we getting there when we know all? It's because people don't really know that these things give you cancer.
Yeah, I think like Nadoko mentioned, we actually are becoming more sedentary. You know, we said we are not really exercising much.
Yeah.
And a lot of the time you're working all the time behind your computer. So you really don't have, you walk, you actually sit in the car, in an air-conditioned car to the office. You are sitting down the whole time.
There's air conditioning there too.
I know. Then after that, you get up and you go back into your car and you walk. So you drive home. So you really do not, I mean, there's not much exercise. We are not walking as much. We are not farming. We are not doing backyard garden. We are not, I mean, doing as much work as we should. And that is also, and the foods we are taking in, because some of them have been known to have some carcinogens, things that can cause cancers or put you at risk of developing cancers. Alcohol, smoking, I mean, all of these. And you know, there's the familial aspects, the genetic ones, the ones that put you at increased risk of developing cancer. So if your father develops this cancer, the likelihood is that you may develop that cancer. That is just about 5 to 10% most of the time. But they are what we call the somatic ones, the ones which can develop from anything, any mutation or any change that happens in your genetic makeup. And like she said, there's always a repair. There's damage and repair. The body is so beautifully created by our God that once there's a small, things are happening in a cyclical fashion. If there's a small change somewhere, suddenly there's a policeman there in the cycle who is making sure that, hey, let's correct this. Right, and then, because if that correction doesn't happen, something goes through, the mistake goes through, another one goes through, eventually builds up, then we have a cancer. So the foods we eat, some of the foods we eat, and even the pollutants. I mean, we have a lot of plastic waste and so much now. Galamsey is becoming an issue. We don't know what's going to happen years down the line because of the lot of mercury and metallic, pollution of the water and all. So these are all risk factors. Even, some time ago, we had a lot of asbestos roofing sheets, and those were also known to cause some particular cancers, the covering around the lungs, you know. So these things, there are a lot of things. We are becoming more industrialized. So the risk of developing cancers, which under normal circumstances may not have been there, is becoming higher. We are also preserving our foods with all sorts of things, which we don't even know as at now what the risk will be, but down the line it will happen. And you see that there are regions around the world where some cancers tend to be more, common. For instance, if we have stomach cancers, they tend to be more common in Japan, China, and other areas. And they notice that it's actually because of the kind of food they eat that tends to increase their chances of developing those cancers. Even for Ghana, some studies done have shown that some head and neck cancers tend to be common along the Volta belt, somewhere there. Yes, some of my colleague ENT doctors have done some studies, and people may say, well, it may be because of probably the food, the kind of food they eat along there. So food also has a role to play. But you're very careful when you start talking about that, because next moment, people, if you eat this, you're going to get cancer if you eat this. And sometimes journalists don't also help much. The headline has to be catchy. So then, because of that, and then people become unusually or overly frightened about that. That's not the intention. We just want to help us to eat healthy foods, balanced diet, a lot of vegetables, some protein, carbohydrates. You can't eat without having carbohydrates. There's a function. It provides energy for the body, fruits, etc. So for us to have a balanced diet. So all of these are
contributing factors. I have personal experience, and maybe my next question will be to you, but my personal experience is a couple of months ago, I had an event. I think I over-screamed or whatever it is. I started losing my voice. So it was Saturday, Sunday, Monday, I'm recovering the voice back. And then a week after, it gets worse again. And so I was very alarmed. In fact, my team were all saying, go to the hospital. But for me, I was scared. Because the next thing that came into my mind is, what if you go and it's cancer?
Cancer of the voice.
So for 2 months, I was still struggling with normal medication. I'm drinking water, warm water, I'm doing this just to make sure the voice comes back. It was not happening. Eventually, I had to show up at the hospital. And when I get there, the doctors look at me and they say, how long has this been going on? I'm like, two months or so. Then everybody start looking at me some way. Now, now we need to go and open my mouth, put some light in and check. Eventually, I was told that I think I over-screamed, so my voice, something was swollen. So instead of the voice coming back together whenever I scream, it doesn't come because there's a sore or something like that. I was giving medication. Now my voice is back. It comes back to how we are taking the information from the doctors when we go for diagnosis. Somebody like me, when I get there, and I'm told you have cancer, how do I receive a message like that? And how do I go about it, first of all?
Okay. So breaking the news is very, very important. How we communicate, how the doctor communicates with the patient is very key. I also have a personal example. Some few months ago, I've been in the department since 2015, and I always see patients. You have to break the news. You tell the person that, your pathology report came back and you have cancer. We've done the biopsy and this is what it is saying. So it's like you take the person through the routine. You just give the information. But some few months ago, I also developed a lesion on my gum.
Okay.
I became scared. I'm always the one giving the information out to people. But when I developed the lesion, I went to the maxillofacial surgery department and they said I needed a biopsy. But as a doctor, I wanted someone to tell me that you don't need the biopsy. Just go and take this medication.
And then you're fine.
And you're fine.
Yes. Similarly.
And I was scared. At that point, nothing made sense. My colleagues spoke to me about it. Oh, go and do the biopsy. But I was so scared.
Yeah.
I went to do the biopsy. Now, waiting for the results was another thing.
This is cancer we're talking about.
Exactly.
When I got the results, it was negative for cancer. So I was elated. But then I sat down and said to myself, you've been in this department for all this while. You meet patients, you talk to them, you tell them that, you have this, your result is in, this is what we have to do for you. But when it got to me, nothing made sense at that point. Nothing made sense at all. So now I'm able to, since having that experience, I'm able to talk to my patients better.
Yeah.
Let them know that I know what you are going through because I've been there. And we work hand in hand with clinical psychologists. So the doctor might give the initial diagnosis, but then just looking at how the patient responds to the information you are given, we usually bring in the clinical psychologist when we realize that this patient is not really getting
ready
what
for this kind of news.
We have a clinical psychologist we bring in to also talk to the patient.
And it does work?
It does work.
Okay.
It does work. So I believe it's the communication. It is the communication. When you experience it yourself, you would know how to communicate with the patient.
I mean, eventually I had to stop. They gave me medication. I had to stop going because I felt that I've come back to my normal self again. The fear that was there right from the onset. 2 months, I was still escaping. They would say, go. I said, no, I won't go. They say, go. I said, I won't go. So, yes, it comes to that point. But you see, it's one of the most difficult things that you can take because this is between life and death. Now, the possibility that you might lose your life, depending on which cancer you have, is very high. Going through that process, now you've been told the story, how it looks like. How do you keep up as a patient, Doc? How do you handle this, moving through the treatment and everything?
So I always say that one of the things that we need to understand about the treatment of cancer, because often once we find out you have cancer, we need to decide whether the cancer you have is curable or not.
Okay, that's another step.
Exactly. Because some of them are not curable. And unfortunately, they are not curable because the patient doesn't come to us early. In Ghana, we seek all kinds of interventions before we eventually get to the doctor. Yeah. So they would have gone to see the pastor who would determine whether or not they can have surgery. They would have seen the herbalist, all kinds of people. Sometimes even within the hospital setup, they might have seen a lot of doctors say, I have a constant headache, or I have an ulcer, a wound in my mouth that is not healing. they'll give you antibiotics and more antibiotics. So sometimes by the time they come, the cancer may have gone to other parts of the body. At that time, it's not curable. But then we can also have people who come in early enough that the cancer is curable, right? And so we need to make that distinction as to who is curable and who is not curable. Then once we've done that, you need to understand that the treatment of cancer is a process. So as Ghanaians, we are used to, I have malaria. I take medication for 3 days. It's gone. Life gets back to normal. Unfortunately, cancer is not like that. Because as you can imagine, it's the growth of the cells are integral to you. It's part of you that is growing. If you have an infection, it's something outside of you that has infected you. When you have cancer, it is your body that is against you, right? So there's a whole process to try and destroy the cancer while protecting you. And so it's a delicate balance that requires multiple things. So for cancer, we have several modalities we use for treatment. Surgery may be one of them. Giving chemotherapy is one of them. Adding radiotherapy is one of them. So surgery, we remove the abnormal part of the body. And depending on the stage of the cancer, which is the extent of the cancer, the surgery may be limited or it may be extensive. So in the breast, for example, we may remove just the lump and a small bit of normal tissue.
Okay.
Or if it is too advanced, like you have changes in the skin and everything, we have to remove the whole breast. Then there's chemotherapy. Remember I said cancer doesn't stay where it started from. It goes to other parts of the body correctly. And it usually goes to other parts of the body through your blood. There's also another network called the lymphatic system. Sometimes even to the adjacent cells, so the cells close by. Typical example is your breast. It will move into your armpits, sometimes directly into the lymph nodes in your armpits. Yes. So we need to deal with the possibility that the cancer cells may have gone through your blood or gone through the lymphatic system. And so we give what we call systemic therapy. And the systemic therapy includes chemotherapy. It includes what we call now targeted therapy. And the aim of that is that if the cancer has gone anywhere in the body, this medication will try and go and kill the cancer cells there. And we can give it in any order. We can do the surgery first, or we can do the systemic therapy first. Then after all of this, you may need what we call radiotherapy as well. And radiotherapy just uses very strong rays, typical to what the sun produces. And we direct these rays to the site where the cancer was previously. Or in certain cancers, like the head and neck cancers, it's the only treatment. You add some systemic therapy to the radiotherapy. But the good news is that the abnormal cancer cells, they are unable to repair damage that the radiation would cause. Okay. And so they will die. But your normal cells, because they are more intelligent, will usually stop growing and correct the abnormalities from the radiation. So by that differential benefit, the cancer cells will die, but your normal cells will survive. So the radiotherapy would add on to all of these other treatments that I've spoken about to make sure that wherever the cancer was at first, the cancer will not come back there again. So, for example, if it's in your breast, we give the radiation so that it doesn't come back in your breast. And in fact, over the years, we found out that it isn't just the local area that benefits from the radiotherapy, but also when you give radiotherapy, cancer cells elsewhere in the body can actually die in response to the death of the other cells. Exactly. And so these are the things that we put together to, once we've determined that you are curable or not, we use these to try and control your cancer.
We'll get to the point where you personally be told that you are taking it to your grave, and how you deal with situations like that. We just trying to see on the show. We're looking at cancer, the epidemic that has caused a lot of troubles already, but we're trying as much as possible to understand how it is and what we can do to prevent ourselves from getting into such situations. Now, Dr. Hannah is here with us. Dr. Samuel is here with us as well, and Dr. Na Odoko is also here with us, and the three of them are helping us understand this the very best way they can. Okay, so I'll move on to now number 2 or now number. Okay, now I'm confused. But Dr. Hannah,
you see, if I should mention my name, Na Gogwe.
Okay, now Gogwe. Now they're confusing me, but it's okay.
Okay. Yes.
Doc, as the patient, doctor has spoken about the treatment and all of that. Now, once you get into this stage, your life changes. So many things happen with you as a patient. How do you manage yourself in terms of what to eat, in terms of where you even go, the kind of friends you make and all of that? Because there are some friends that you make, you're not careful, they'd rather be increasing your speed to the grave instead of helping you stay alive. How do you go about it as a patient?
Okay, so I think Na mentioned and someone mentioned some important things about the psychology of the whole process. The patient, first of all, sometimes you go through the normal denial phase where you are still adjusting to the information that has been given to you.
Yeah.
And especially when the information is probably that the disease has spread to other parts of the body. So then, even then, there are patients who are still living long enough now.
Okay.
So it doesn't mean that the fact that it's spread, some people have lived even up to 10 years and more with disease that has spread to other parts of the body. So that just gives some hope. But then once that happens, your psychologically you are dealing with this, and this is where you need a lot of support from the family and your immediate, spouse, your children, your relatives and all. And fortunately, Ghana, that's one of the areas we are excellent at. Family support and love, extended family, even support from the church and all of that, and the mosque and all of that. So you are dealing with this situation, and then, because then some people may become depressed.
That's also another phase.
That is also another phase altogether, which you have to, because you need to get to the point where psychologically you are ready to be able to go through the treatment that you are given. Because some people decide there and then that there's nothing, they won't go through it. They are just going to, it doesn't matter what happens. Yes, and that is really not a good place, you see, because cancer can be devastating in the way the kind of response or what happens along the line as it progresses. So if you come to the decision that you don't want anything done for you because of that, what is going to happen is, apart from the stress you are going to go through, your immediate relatives are also going to go through a lot of stress, because then they have to deal with what you are going through. The caregivers are a very important part of the healing process in cancer. Those who are directly helping you. Some people are so helpless, they need others to help them, and they are the backbone, the support. So your nutrition, eating well, because like Na mentioned, you are also going to be, the normal cells are also going to be destroyed at some point, but they are repairing. But you need to have good nutrients to be able to help the body withstand the treatment process. So once you have that, even though cells are dying and all of that, you still keep fit enough to be able to go on. Unfortunately, sometimes when people develop cancers, because of, like I mentioned, the food aspect, once you start mentioning certain particular foods, there are patients who come, they have lost their blood level is so low, they're so anemic. When you ask them, why aren't you eating and all, this, my mother said I should not take this. My dad said I should. This auntie says this person took that, and so they are restricting them from eating all kinds of things, and they come with low HB, not because of the disease process or the medication they took, but because they are listening to all the doctors, in quotes, I call them at home.
Doctors.
Yes. I say they are the family doctors. They are listening to them. So because of that, they are not eating well. So as much as possible, we want them to be well fed, nutritious food, balanced diet, so that they have enough energy to take in, to withstand the rigors of the treatment they'll be going through. And then the support, like you mentioned, friends and all of that. I noticed that sometimes people are not sensitive. Sometimes we lack sensitivity in the way we handle. You see someone, you've put on so much weight. oh, you've lost so much weight. Why have you lost so much weight? And you know, even the airs with which that is said and all of that, without thinking twice that person may actually be going through a very difficult time in their life. But you know, people just talk, and sometimes, oh, me, I just say it as it is, and then just walk away. No, you know, you probably may be, that person is trying to deal with the situation, because sometimes when you take chemotherapy, you're also taking steroids and others. That is going to make you put on weight. So the person who is commenting about putting on weight does not realize that you are going through something requiring you to take certain medications that's making, or you have been restricted, your diet has been restricted to the extent that you are not supposed to take certain things, or you are adjusting it. So, or maybe because of the cancerous, the process that you're going through, your body is losing a lot of mass, you know, a lot of muscle mass, and a lot of, so because of that, you've lost weight. So I think as much as possible, not everyone will freely tell you, also because of stigma. Unfortunately, there's some stigma attached to cancer, a lot of stigma, even in this country. Worldwide, other places, in developed countries, you realize that people will even come out and let the whole world know that they have cancer, and there's a lot of, and support, people support them, and they are on Instagram, they are on Facebook, support, and I tell you, but here, because of little gossips here and there, and people get to know that you have the disease, and they're talking behind your back, and they're commenting. So people are very skeptical as to what they say to others. So they may not really tell you they're going through this, but you need to have sensitivity. So I think we need to be very sensitive in how we relate to our friends. And also, when you happen to know, support them. It's so nice if you brought a pot of food or something, or some friends, you decide, okay, maybe Amma is going through this. Let's all rally around, maybe gay girls or something, go and sit with her, have fun, play Ludo, you know, support her during the treatment. I think there's nothing more beautiful than that. So support.
Very necessary. We'll look at some of the institutions that are helping with regards to this, and also if the government is also putting any effort. Unfortunately, we're pressed for time. But Dr. Samuel, let me find out from you. Do you think that we are seriously a country that is supposed to be worried about the way we see cancer and what it can do to us? Because from all that we've stated, it means that people don't even really care like that. You know, is this something that we have to be extremely bothered about now?
Yes, as a country, we should be worried about cancer. The psychosocial and economic impact of cancer on a country can be very devastating. Management of cancer is very expensive. So I believe the government should pay a close attention to cancer. We have to have a robust cancer control program. I can give you examples from just occupational exposure to cancer, as Dr. Annie and Dr. Anna were saying. I can give you an example of this galamsey menace. The chemicals that are being used, okay, and the exposure these miners have to radon gas can bite us down the line.
Wow.
Okay. Another example would be the agric sector. We are industrializing. So these chemicals that are used in pesticides and all that, they can lead to cancer down the line. Another example, hairdressers and cosmetologists. The products they use, some of the dyes are carcinogenic. Wow. So these are just examples. So even if we put away the modifiable risk factors, like the smoking and all that, there's still a huge part that needs to be tackled. So I believe the government needs to pay very, very close attention to cancer.
Okay, we have to go, but I'll give you the opportunity for all of you to send some sort of message. It can be somebody who's going through the process already, somebody who's just been told that you have cancer, and all of that. Let's see how best we can, manage some of these situations. I'll start with it. And the entire country, by the way, because our lifestyle, for example, right now, I went somewhere in Kowu this year, and Shisha was like, okay.
The thing, right?
It was just crazy. It was just crazy.
One of the things that I think is probably important to me is the fact that you can actually find cancer before it gives you any problem. Mm-hmm. And if we search for that cancer early enough, we can find it and intervene. So, for example, doing a mammogram after the age of 40 once a year or once every other year, we can find cancer in the breast so small that sometimes just removing it may be enough. Mm-hmm. If you do a pap smear regularly, we can find cervical cancer so early that it shouldn't give you any problems. If you are more than 50 years, you need to do what we call a colonoscopy, where we'll put a tube and look into your large intestine, which is a common site of cancer as well. If you are a man and you are more than 45 years, a black man, more than 45 years, you do a PSA. So there's what we call screening. And screening finds cancer even before it gives you problems. For me, I believe that that's one of the ways we can try and tackle cancer in this country. Mm. And as part of our cancer control program, we must ensure that these screening programs are part of our daily hospital activities. What we do now is that when we see somebody, we say, oh, you're a 45-year-old man, do a PSA. Elsewhere in the world, you get a test kit that says, it's been 5 years. Let's check to see if you have cancer of the colon. So you are likely to find the people early, at which point the cost is cheaper and the survival is higher. So for me, when it comes to cancer, the one thing that we need to do as a country is to encourage a lot of screening.
Okay, thank you. Dr. Hannah.
Okay, so I just also want to touch. I agree perfectly with now screening number one. Yes. Head and neck cancers, one of the areas that a lot of people usually miss. Yeah. Especially nose bleeding, things like that. You could have nose bleeding the fact that you have nosebleed doesn't mean you have a problem, but it could also mean there's a problem. You go for a removal of a tooth or so, and then you still have a sore around the area. It doesn't seem to heal, and you're just going on because we are seeing some advanced cases of head and neck cancers, which could have easily been diagnosed early. So as much as possible, if you should have a sore in the mouth not healing, you should go and see a dentist. You still realize that there's still a sore area which is not healing, or you should have a mass in your nose which doesn't seem to go away, or change in your voice, like you mentioned, things like that. Head and neck is one of my passionate areas. Yeah. I lost my grandma from head and neck cancer.
It's crazy.
At that time, radiotherapy was not really, that advanced in Ghana. So it's one of the motivation factors for me, yes. So I think these are some of the important things. I also like to mention that as much as possible, I think the government, I know there's a lot happening with the NHIE and cancer, and that's really commendable. I think a lot more should be done to help cancer patients pay for their treatment. If we could have free management of cancers in Ghana, that I think would be excellent. We are all getting there. We are all getting, like Mana mentioned, the older you grow, the higher your chances of developing cancers. And if we don't do something about it, we all may not be able to go outside for treatment. Right here, we have the treatment. If we build up our health facilities so that we can manage most of these things, you just walk into the hospital and a lot of the stress is off, because majority of it, apart from the psychological problem, is about how am I going to foot this bill? And management of cancers are expensive. So if the patient cannot afford it, then the doctor is now sitting discussing what is the second line, what is the third line. That alone is a lot of stress. because you are trying to think of what else can be done. You know what should be done, but patient cannot afford it. They go and get the bill, they can't afford it. They are supposed to pay it. NHIS is paying some amount of treatment, and in fact, a lot of cancers, nothing. So what do they do? So I think this is a call.
Awesome. All right, Doc, you are good with us, right?
I just want to add that as individuals, we cannot wish cancer away. A diagnosis of cancer is not a death sentence.
Yeah. Report
to the hospital early. Thank you.
Okay. Now, the last question that somebody is asking is about laser treatment, and the person is asking if it's another cancer situation where you're supposed to be looking at laser treatment.
Will laser treatment cause cancer? Well, for majority of the laser treatments, no.
Okay.
Yes, in fact, laser is used for management of certain early stages of cancer as well.
Oh, okay.
So not quite. There are other more serious things like shisha and alcohol. Yes.
Don't kill for the shisha.
Yes. I hope the ladies are listening.
Yes.
If you're taking shisha, you need to be careful.
Just to say something, someone alerted me about something else concerning my dad, concerning the visual problem. Sometimes you could have visual problems, but it may be because there's something happening in the brain, or you could have changes in your hormones, and that is usually one of the things that we miss. The tumors that may happen in the brain. So it may cause changes in your vision, changes in your hormones. You're probably bleeding too much, or you are lactating when you are not pregnant, things like that. So then it also should lead you to. So if something abnormal is happening, simply put, as much as possible.
Great. Many thanks to Dr. Hannah Nagwe Aite, and she's a senior specialist oncologist, National Radiotherapy, Oncology and Nuclear Medicine Center, Kolebu Teaching Hospital, a part of the Ghana Medical Association. Dr. Samuel Ntiamu Abuateng is the only man that joined the two awesome doctors we had today. He's a special clinical radiation oncologist as well from the Ghana Medical Association. Dr. Na Adoko I hope I got that. I just said it right. Pardon me. Clinical oncologist, Kolebu Teaching Hospital, Ghana Medical Association, and the three of them have been awesome. Thank you so much. We're most grateful for your time this morning here on the show. We hope to see you guys again, right?